Greetings to everyone watching this video. Myself Abhinav Santosh, a student from Mawadi University, SYBPT. And today I'll be explaining you about phobias. So exploring the physiological manifestation of fear, autonomic arousal pathways and the essential role of physical therapy in management. Understanding phobias. Investigating how irrational cognitive fear constructs trigger profound somatic responses and functional movement deficits. The clinical classifications. Specific phobias. Localized irrational fears triggered by objects or events. Example, arachnophobia, acrophobia, hemophobia, which triggers immediate sympathetic arousal. The social anxiety. Persistent fear of public performances, scrutiny, or social exposure results in severe muscular guarding and tremor presentation. Agoraphobia. Extreme fear of spaces where escape or assistance is unavailable. Strongly limits spatial mobility, physical exercise, tolerance, and outdoor gait. Moving further with neurobiology of fear. The fight or flight circuit. Amygdala central command processes immediate threat inputs, bypassing cognitive filters to activate the hypothalamus directly. Sympathetic overflow triggers release of epinephrine and neuropinephrine from the adrenal glands. Somatic outcomes causes immediate peripheral vasoconstriction, elevated pulse rate, and dynamic muscular splittings. Somatic manifestations. Musculoskeletal guarding. The body responds to phobic stress through sustained contractions of postural stabilizers, increased stiffness in upper trapezius and levator scapulae, development of active myofascial trigger points in the neck, temporomandibular joint grinding and clenching. Moving further with cardiorespiratory strains, autonomic dysregulation leads directly to inefficient and highly fatiguing ventilation patterns. Apical or clavicle breathing pattern dominance. Hyperventilation leading to acute hypocanipia, chest wall tightness, and respiratory muscle fatigue. Myofascial stress loop. Bidirectional somatization, emotional stimuli response. Emotional fear triggers immediate mechanical vasoelectric stiffness in the fascia and muscle tissues. Proprioceptive feedback. Constant hypertonic sending stress signals back to the brain. The chronic vicious cycle. Tissue stiffness feeds anxiety, which triggers more muscle bracing, restricting joint range of motion. Diaphragmatic breathing. Restoring autonomic balance. Severe phobic panic frequently triggers rapid, shallow hyperventilation. This response leads to respiratory alkalosis and muscle cramping due to decreased carbon dioxide levels. Physiotherapeutic breathing re-education focuses on slow abdominal diaphragmatic excursions. This deep, controlled breathing activates the vagus nerve, initiating a parasympathetic response that quickly lowers heart rate and reduces systemic muscle tension. The final topic, somatosensory therapy. Evidence-based modalities. Progressive muscle relaxation. Systematically teasing and releasing muscle group to help patients recognize and release residual muscle guarding. Myofascial release. Hands-on therapy targeted at relaxing tight connective tissue, helping break the physical pain stress cycle. Basic body awareness therapy. Exercises focusing on posture, balance, and coordination to help patients reconnect with their body in a calm, grounded state. Thank you and have a nice day.